Dr. Service, what do you think are the greatest opportunities for young psychiatrists, and what direction are you giving to your trainees at UC Davis?
Oh, it's an exciting time to be a psychiatrist, predominantly because of the advances in neuroscience, and also to some extent in psychopharmacology that point to an exciting future where I think we'll have a much better understanding of the basic mechanisms of a number of the diseases that we wrestle with, and linked to that, I think we'll almost certainly have new treatment approaches that I think will hopefully be able to address some of the more persistent and severe psychiatric illnesses that we struggle with now. So I think the future psychiatrists are going to have a great time adding in our understanding of psychopathology through neuroscience to what we have known clinically in our work with patients, and pointing us towards new approaches that will incorporate those advances, I think, in very exciting ways. When I trained as a resident, there was really very little that neuroscience added to the work of a psychiatrist. We certainly believed that neuroscience and brain disease underlied the kinds of things that we were seeing, but we couldn't use it very much in our actual work. Our diagnostic system was a descriptive one. Our therapeutic system of both psychotherapy and medication was just based on trial and error more than anything. But as we truly get to the root of understanding behavior and psychopathology, I think we're going to have a much clearer and rational approach to treatment that I think will be very exciting to be a part of. And so the future is very bright. And then I think there's some neat niche areas that psychiatrists should be taking advantage of that are kind of overlooked in addition to all the traditional things that we've done. One is, I think, looking at the phenomena of eating, obesity and eating disorders. For whatever reason, psychiatrists have not engaged a whole lot around the problem of obesity, even though it's a behaviorally based problem. And I think psychiatry has a lot to offer, and it is obviously an issue of a public health issue that is really very important. I also think that there's hopefully an increased role for psychiatrists in helping patients with concurrent medical illnesses, in particular neurologic illnesses where there's some obvious overlap and a lot of psychiatric comorbidity. But as I think everyone is aware, a number of medical illnesses have large psychiatric comorbidity that I think that to me, if I were a young psychiatrist, is an area that I would be attracted to. And then I think another area that is going to really grow and where psychiatry could play a really significant role beyond what it's been doing is in substance abuse and substance abuse treatment. Again, an area where in some ways we've not taken the lead as much as I think we could in psychiatry. We've sort of let others, even in medicine, get involved where we sort of stayed back from that. And I think psychiatrists are the best equipped to deal with patients with substance abuse problems. And I'd like to see us as a field really advance in that area. And of course we do have addiction psychiatry as a subspecialty, and it's an area of focus for many psychiatrists. But I think given the magnitude of the problem and the general pattern of how medicine has addressed substance abuse, I think psychiatry could have a much more significant role. And then finally, and this is a little bit related to the medicine-psychiatric interface, I think psychiatrists should be involved with complementary and alternative medicine treatments, or CAM. I think a lot of our patients, the ones that we see as psychiatrists or should be seen, are ending up in CAM treatment, which is probably great. But I think it would be really super to have psychiatrists involved there as well. That's where our patients are. That's where I think we can actually be helpful to CAM practitioners. And we can take advantage of the kinds of really fascinating, interesting treatments and knowledge that they have in approaching our patients who are having typically complex medical psychiatric complaints that I think in many ways CAM might be a very effective way of approaching those problems.